Kayla Galloway. It is August 15th of 2019, and today I'm going to be going over my favorite organ system. So as you can see by this flashcard, you can probably tell which organ system I'm going to be discussing today. Yep, you guessed it. It's the nervous system. So the nervous system consists of the brain, the spinal cord, and peripheral nerves. It can be divided into two parts: the central nervous system, which consists of the brain and the spinal cord, and the peripheral nervous system, which consists of the peripheral nerves. Right? There is something called neurology. Neurology is a medical specialty of the nervous system, and it is involved in the treatment and diagnosis of diseases of the nervous system. So there is a subspecialty. There are two subspecialties actually. One is a clinical specialty and one is a surgical specialty. So let's go into the difference between these two. So the clinical specialty of the nervous system is known as neurophysiology. Neurophysiology is involved in the diagnosis of these diseases of the nervous system. That's their job. That's the neurophysiologist's job. They diagnose these nervous system diseases by using research and clinical methods. So that's their job. That's what they do. And then what the neurosurgical specialists do is that they perform surgery and management of the disorders of the nervous system. So they're going to be involved in the treatment more so. That's the difference between the two. All right, so let's go into my favorite organ of the nervous system, the brain. So the brain, it is located superior to the spinal cord. There are cranial bones in our skull, of course, and the frontal bone is going to be located anterior to the brain, while the occipital bone is located posterior to the brain. Right? So there are 5 anatomical landmarks that I'm going to be discussing today. The first one is going to be known as the cerebellum. The cerebellum is going to coordinate voluntary movement such as posture, balance, coordination, and speech. And then there is another anatomical landmark known as the cerebrum. The cerebrum performs higher functions like interpreting touch, vision, and hearing, speech, reasoning, and it also is involved in emotions and learning, fine control of movement also. Right. So then next there is the diencephalon. It's the third anatomical landmark. It consists of the thalamus and the hypothalamus. The thalamus is involved in it's pretty much its center is the relay and processing center for sensory information, while the hypothalamus center is center for controlling emotions, autonomic functions, and hormone production. Great, so let's go into the fourth anatomical landmark, the mesencephalon or the midbrain. It functions in motor movement of the eye and in auditory and visual processing. Okay, let's go into the fifth anatomical landmark, which is the pons. The pons helps in controlling breathing and communication between different parts of the brain. It also helps in sensations such as hearing, taste, and also balance. All right, so that pretty much covered talking about those anatomical landmarks, those 5. That covered a lot of the functions of the brain. So I'm just going to give a brief summary. The brain, it helps to maintain the body's homeostasis with electrical signals. It provides sensation and perception. Also, it provides higher mental functioning, emotional response, behavior, and it activates muscles and glands. So the brain is like necessary for life, of course. It is the control center of, and it sets the stone for what our body is going to do, for the actions that our body makes, whether it's voluntary or involuntary. Right. Thanks for watching.